Muscles, mammary glands, cross-section. Thoracic wall. Muscles, mammary glands, cross-section, thoracic wall muscles. Surface muscles, anterior. Platysma. Pectoralis major. Pectoralis minor. Subclavius. Serratus anterior. Refer in syllabus. Table 1, pages 47 to 49. Figure 13, p50. Surface muscles, posterior. Latissimus dorsi. Trapezius. Rhomboideus major. Rhomboideus minor. Refer in syllabus. Table I, pages 47 to 9. Deltopectoral Triangle. Boundaries. Anterior border of the deltoid. Superior border of the pectoralis major. Middle third of the clavicle. Deltopectoral Triangle. Contents. Cephalic vein. Deltopectoral lymph nodes. Deltoid branch of the thoracoacromial artery. Clavipectoral fascia invests subclavius and pectoralis minor. Attached to clavicle and anterior thoracic wall. Pierced by cephalic vein. Thoracoacromial artery. Lateral pectoral nerve. Become suspensory ligament of the axilla, thoracic wall structure, XS. Refer to Figure 15, p. 60 in syllabus as well as background material on pages 58 to 59. Mammary gland. Mammary glands modified sweat glands 15 to 20 lobes. Lobes separated by fibrous septa. Luctiferous duct, 1 per lobe. Luctiferous sinus, ampulla. Dilation as duct enters nipple. Mammary glands fibrous telesubcutanea, fatty telesubcutanea. Connective tissue layer surrounding the entire gland. Fatty telesubcutanea. Adipose tissue deep to fibrous layer. Suspensory ligament of Cooper. Bundles of collagen fibers in dermis and hypodermis. Mammary glands. Breast extends from 2nd-3rd rib superiorly to 6th-7th costal cartilage inferiorly. Extends from lateral border of sternum to beyond the anterior axillary fold. Mammary glands retromammary space, sinus mammarumis. Space between the gland and the pectoralis major muscle. Sinus mammarumis. Space between the two glands. Mammary gland arteries. Anterior perforating arteries. From internal thoracic artery to medial part of gland. Medial mammary rami. From 2nd, 4th anterior perforating arteries to deep medial part of gland. Mammary gland arteries. Lateral mammary artery. From lateral thoracic artery to inferior part of gland. Lateral mammary rami. From lateral cutaneous branches of intercostal arteries to lateral part of the gland. Mammary gland veins. Superficial and deep venous plexuses drain into internal thoracic, lateral thoracic, and intercostal veins. Mammary gland nerves. Lateral mammary nerve. T2-T6. Anterior branch of lateral cutaneous branch of intercostal nerves. Medial mammary nerve. Lateral branch of anterior cutaneous branch of intercostal nerves. Mammary gland lymphatics. Paralobular and interlobular lymphatic vessels. Into subareolar plexus. Lateral lymphatic trunk. From lateral and superior gland. Medial lymphatic trunk. From medial and inferior gland. Mammary gland lymphatics. lateral lymphatic trunk and medial lymphatic trunk. Into pectoral group of axillary lymph nodes, subclavian lymphatic channels, mammary gland lymphatics, accessory lymphatic drainage. Periphery of gland drains into apical group of axillary nodes and follows thoracoacromial trunk. Circumareolar channels drain into sternal chain. Thoracic wall lymphatics. Lymphatic drainage subareolar plexus of nodes axillary lymph nodes. Receive from superficial tissues, skin, breast, extrinsic limb muscles. Include pectoral group, lateral group, apical group, subscapular group, lymphatic drainage infraclavicular nodes, parasternal nodes, abdominal nodes, mechanics of respiration. Inspiration, bucket handle. Involves contraction of intercostal muscles. Results in raising of ribs. Results in an increase in the lateral dimensions of the thoracic gauge. Inspiration, pump handle. Results from raising of sternum. Results in increase in anteroposterior dimensions of thoracic gauge. Abdominal breathing results from lowering of diaphragm. Phrenic nerve. Necessary when infant costal cartilages are calcified.